Live from the Washington, D.C. area, it's the Inside Scoop. All the news that our viewers want to know. Now, here's the host.
Oral cancer. Every year, 7,000 Americans die.
Welcome to Inside Scoop, Virginia. I'm Bettina Lawton, your host. And we have a special show tonight. Every now and again, something piques my interest and I don't know enough about it. And then I decide that, well, if I don't know enough about it, you all probably don't know anything about it either. And so I should have somebody come and explain it to you. And that is one of these shows. And it's going to be about chiropractic care. Now, before you go, oh my gosh, that's just hocus pocus, we don't know anything about this, I will tell you that growing up in the 60s, my dad had a chiropractor and my mother called him Butcher Begonia. And his last name may have been Begonia, I don't know, but I'm pretty sure his first name was not Butcher. It was a reflection of my mother's view, that it was all kind of hocus pocusy and what was that all about, and she all thought it was quackery. So I kind of grew up with that, and I've sort of changed my mind. And I have with me tonight an esteemed local chiropractor named Dr. Chuck Masarsky. He is in practice in Vienna, Virginia, and he is also an adjunct professor over at Nova. He got his Doctor of Chiropractic in 1981 from New York Chiropractic College, and he got a Bachelor's of Science from Cornell University, also in New York, in 1975. And he has been practicing here in Virginia for 30 years. He is also on the medical malpractice panelist for the Virginia Supreme Court, so he gives some advice in that respect as well. And I want to welcome you, Chuck, to the show, so you can explain to us all about the wonders of chiropractic care and what this is about.
Very pleased to be here.
Well, let's talk about what is chiropractic. People think it's bones. You're doing stuff with bones.
Well, the chiropractic adjustment actually is mostly about the nervous system. And what we're trying to do is to get the nervous system to transmit its information in an accurate way. I can do this by way of analogy. I don't know if we have that overhead on the scrambled message. Is that,
I don't think we do.
We don't do? Okay, well, we're going to improvise then.
We'll improvise.
Imagine a message.
A message.
Okay.
Got it.
The message says IFMQ.
Okay.
IFMIC. Okay. You have no idea what to do with that message, right? That's because the message is scrambled. The message has been moved one letter to the right in the alphabet. You've got to move it one letter to the left so the I becomes an H, the F becomes an E, and the entire message says help. Now it makes sense.
Right.
Okay? Imagine further that you've misaligned something slightly in the spine. Okay. And that has scrambled the messages moving through your nervous system. Muscles, glands, internal organs, blood vessels are not going to work properly. They're going on flawed messages that have been scrambled. We adjust that misaligned vertebra or other joints into a normal alignment, allowing the messages to move through the nervous system in a more normal way. That helps people with pain and spasm, as everybody knows. Even Butcher Begonia did that. But right. Also many other functions improve as well, and this is done without the hazards of drugs and surgery.
So the notion of bones, I guess, is because of this involvement of the spines. If I remember, and I may not, my rudimentary biology from high school, that's because the spine is hollow, sort of, in the middle of it. Isn't there things weave in and out of it? Is that why moving it helps align nervous system issues? How does that work?
Well, the spine is supposed to move.
Oh.
I mean, yeah. Basically, what you have with the spine is a movable armor. You want to protect the spinal cord, which is part of the central nervous system, but you want the body to be able to move. So what you have is a series of bony rings reinforced by a dense network of connective and muscular tissue, which is a very, very powerful type of armor. It's sort of like samurai armor in a way. It's sort of like chainmail. Okay? It's movable, but it's very, very tough. And the spinal cord has to communicate with the rest of the body. Therefore, the spinal cord feathers off nerves that leave through openings in between the vertebrae. And that's a perfect system, except every now and again the movement or the positioning of a vertebra becomes abnormal. And that creates an irritation just where a huge amount of biological information is leaving the spinal cord. And that's what we correct. We used to call these things pinched nerves. Now we call them the vertebral subluxation complex. Your profession is law. Why do you think we call it the vertebral subluxation complex?
Because no one else can say that.
Because it has more syllables, right? And basically, these abnormal positionings or abnormal movement of the vertebra disturb the nerves, and we get the kind of scrambled message that I was talking about before.
Now, is chiropractic as a medicine, is that new? I mean, how old has that been around?
The idea of helping the body by performing corrections on the skeleton in general and the spine in particular is actually ancient. Hippocrates of Kos, the father of healthcare, the father of medicine, and we believe the father of chiropractic, spoke about looking to the spine because there is the cause of many diseases, and he had a number of manipulations that he used to do, and that is recorded in some of the ancient writings. But chiropractic as a healthcare profession in the United States began in 1895 in Davenport, Iowa, at a time that there were a number of practitioners of non-orthodox medicine practicing. A lot of these methods involve the laying on of hands, and one of those methods was called magnetic healing. A gentleman by the name of D.D. Palmer was one of these magnetic healers, and one day he had a conversation with the janitor in his building. The janitor had become hard of hearing 17 years previous to this after he lifted a heavy object and felt something give way in his upper back. D.D. Palmer came up with an educated guess, or what we call in the scientific method a hypothesis. Maybe that giving way in the upper back and that loss of hearing were connected. So instead of doing a general laying on of hands, maybe I could do a specific maneuver on that spot in the upper back and see if it solves the hearing problem. Now, to most people, exactly, that facial expression is exactly, so why did this janitor agree to undergo this? Why did he go for it? What was it in his psychology that made him accept such a dramatic change? The janitor, his name was Harvey Lillard. He was African American. He was born in the 1850s in Texas, when Texas was still a slave state. Now we're at 1895. In his lifetime, he has seen Texas leave the United States of America, join the Confederacy, saw the Confederacy defeated, saw the institution of slavery disappear, had seen the Transcontinental Railroad built. He had seen momentous change in his life, and maybe he was predisposed to think, well, maybe this 17 years of being hard of hearing can change too. He agreed. The first chiropractic adjustment was done. Harvey Lillard's hearing was restored.
Oh my gosh.
That's how he got started.
I'd never heard that. That's really a great story.
Yeah.
A truly great story. And the sort of the laying on miracle kind of worker type story is.
Yeah, well, the miracle sadly was not repeated. He thought, D.D. Palmer thought he had a cure for deafness.
Oh.
So the next hard of hearing person came in and nothing happened. But a heart ailment cleared up. And then the next person came in and back pain, which is what we became famous for eventually. Finally, D.D. Palmer put together that what it was really doing was not approaching deafness, but correcting problems in the nervous system. And that was the origin of chiropractic as we know it today.
So it really, I mean, has it, the purpose then is to just deal with the nervous system. It's really not, I mean, I always think after a chiropractic adjustment that I'm not as bunched up. My muscles aren't as bunched up, and I'm not as tense feeling. But that's not really what it's about. It's about the nerve aligning or messaging out from nerves or something.
Well, it is about being bunched up in the tense feeling. The thing is, you don't that tense feeling doesn't come from muscles making up their own mind to become tense.
Okay.
That tense feeling comes from the abnormal messages going to those muscles to cause you to bunch up. You don't always choose your own posture. You don't always choose your own level of tension.
Okay.
It chooses you. So we try to normalize the messages going through the nervous system, and then your body can heal itself.
Wow. Well, I'm always into the body healing itself and the no drugs aspect of chiropractic. So what else? So the guy starts out, he's deaf, and because of that accident or whatever, lifting the heavy object, that gets fixed. Today, a lot of it does seem to be people have a back pain and they come. Are there other things that folks should be looking and saying, oh, this is something a chiropractor could do, as opposed to either tolerating it or going for a bazillion tests with their general practitioner?
Yeah, well, I mean, the general practitioner is there for a reason, and we have tremendous respect for all branches of medicine. And certainly back pain, neck pain, sports injuries are the reason that the majority of the people come in. But there are other things you can look for. As I mentioned, we're talking about abnormal messages within the nervous system. One of the simplest things to look for are changes in balance and coordination, because that's one of the most obvious manifestations of abnormal nerve function. I had a patient a number of years ago who came in, and she said she was having back pain, but it had been going on for about 8 or 9 months. I said, well, what made you come in today? She said, when I put on my socks. When you put on your socks, I gave her that look. When you put on your socks, what happened? Well, every day she would put on her socks standing up. When she couldn't put on her socks standing up, when she had to sit down, she understood that it was time to get checked out chiropractically, because her nervous system was not working properly. And that's she invented that herself. I didn't give that to her. Very simple thing to do is something called the finger to nose test, which unfortunately some people have seen in an encounter with law enforcement.
I was going to say, that's what they do to say, are you too drunk to get your finger to your nose?
Yes. Being drunk disturbs your coordination. Pinched nerves or subluxations also disturb coordination. So one thing you can do is I'm only unbuttoning here. I realize this is cable, but I'm not getting.
But we have standards.
We have standards. I'm not getting. Basically, what you do is you slowly touch one of your fingers to the tip of your nose with your eyes open, so you have full visual capacity, and then you do the same thing with the eyes closed. And if we see something like this happening, that's good. But if we see something like this happening,
right into your eyes,
there's a possibility that there's interference from subluxation. And I understand from the cueing that I should conclude the sentence.
Yes, you should. And we will be right back after this break.
Every year, 7,000 Americans die of oral cancer.
I'm Eva Cohen, and I'm an oral cancer survivor. I didn't fit the profile. I didn't smoke or drink. I had no family history of cancer, no family history of cancer. I was 31 years old. I went to see my dentist about a sore in my mouth that wouldn't heal. It was oral cancer. I had to have a radical neck dissection and a portion of my tongue reconstructed. I didn't know if I was going to live or die.
I'm Surgeon General Richard Carmona. The survival rate for oral cancer is only 50%. Oral cancer can happen to anyone. If you have a sore or lesion in your mouth that doesn't heal within 2 weeks, see your dentist. Early detection is the key.
Early detection saves lives. I know.
1 in 8 Americans goes hungry. One idea helped change that. A community started a garden that blossomed into farmers markets. 1 in 6 children lives in poverty. One group of women found an answer by opening a daycare center that their neighbors could afford. Today, 36 million Americans live in poverty. But one by one, people are helping themselves and each other to change the picture of poverty to one of hope. For easy ways you can help, visit povertyusa.org.
2 words for you. Pop quiz. Ready? Name any funny movie. A drama. Name a mystery. And one more thing. Name the movie your kids saw today in science class.
Know what really matters. Know about your kid's school. And know about your kid. Find out 100 ways to know more, do more.
We're back.
to the Inside Scoop. Here again, your host.
Welcome back to Inside Scoop Virginia. I'm your host, Bettina Lawton, and we have with us tonight Dr. Chuck Masarsky. He is a chiropractor. He practices in Vienna, Virginia, and we're talking about chiropractic care and what it's all about and how it's gotten to where it is today. I mean, it actually is covered by medical insurance, some medical insurance to some extent. I remember years ago it wasn't covered. So obviously there's been some stuff going on. That's what we're talking about. And what I wanted to do, Chuck, was talk about who is it appropriate for? I mean, do you see like babies? Can you see old people? Is there a point like when somebody's so old that their system can't take an adjustment, or when they're so young that it would be really deleterious for them to have it? What's the limits on who you can see?
There's no age limit.
Okay.
The chiropractic adjustment can be modified to suit any person's body. To make it very, very clear, shake hands with me for a moment. So, Bettina's giving me a fairly firm, friendly handshake, which
Right.
is what you would expect.
Okay.
If we didn't do that, we might be worried that one of us wasn't feeling well, or that maybe we didn't like each other or something like that.
Right.
Right? Now, forget that it's us. This is a 2-year-old or 3-year-old child coming up and saying, would you shake my hand? Would you walk away from them and say, no, I couldn't do that because that'll crush your little hand?
Right.
Or would you
No.
modify your pressure?
Okay.
Did you go to a postgraduate seminar to know how to do that, or is that common
No,
sense?
that's common sense.
It's common sense, okay. So we have been through courses in anatomy, physiology, biomechanics, chiropractic technique, and we've been taught a number of ways to safely do a chiropractic adjustment, safely administer a chiropractic adjustment for people with any body type, any age. But beyond that, there's just the issue of common sense. If you can figure out how to shake hands with a child without hurting that child's hand, somebody who's been trained for years in how to administer a chiropractic adjustment can certainly figure out how to modify the pressure and force of that adjustment to do good, not harm, which I just borrowed from the Hippocratic Oath.
Right. Now, how does somebody know? I mean, like this is when I had little kids, when they're babies and they can't talk, they can't really tell you what's the matter. How do you know to take a baby to a chiropractor versus a pediatrician or some other specialist?
Well, you shouldn't take a baby to a chiropractor and not go to a pediatrician.
Okay.
We're not a replacement for conventional medicine. You should take a baby to a chiropractor if there's some obvious distress that doesn't have an obvious reason. For example, if the baby has colic, which is uncontrollable crying, I believe for 4 hours or more, at least 3 out of every 5 days, and there doesn't seem to be any kind of illness, any kind of injury, anything like that, that distress may be getting generated internally from subluxations, which we can locate and correct. So that would be one example of a time that it would be excellent to have a child visit a chiropractor.
And the parents can stop driving around in their vehicle at 2 in the morning trying to get the kid to go to sleep.
Well, let's put it this way. Either will help the problem, or the vehicle that you could drive around to 3 in the morning will still be there. But heads you win, tails you break even.
Right, okay, all right. Well, let me ask you something else, because many years ago, this has got to be 20 years ago, I had a friend who was pregnant, and she had the baby really, really early. I mean, she was like 4 months pregnant, she had this baby. And afterwards, her chiropractor, who she had not been seeing during her pregnancy because she thought she shouldn't, said something to her about, if I had been seeing you, we could have prevented that. And I always kind of thought, really? I mean, is that something that you're familiar with? Are there, and the corollary question is, are there things for which you would say chiropractic care is just not the answer for that? You need to go and do something else.
How about that royal baby in England? What do you think?
What do you think? Big question. I know.
Yeah.
I know.
Do we know what caused the prematurity? Was it something with her cervix?
Yes, incomplete cervix is what they told her.
All right. If I were confronted with that question, I would say there is no such thing as a chiropractic adjustment that is going to complete an incomplete cervix. Right?
Okay.
We can't make matter appear where there is no matter. Okay? So in chiropractic, this is known as limitations of matter.
Okay.
There is some, if the matter isn't there, no amount of information from your nervous system is going to make it come out. That having been said, I think part of what that chiropractor told your friend was true. It would have been a good idea if she had been seen during her pregnancy. We see quite a few patients throughout their pregnancy up until the time of delivery.
Really?
And yeah, if the uterus does not have adequate maneuvering room, the normal movements of the fetus within the womb cannot happen. The delivery is a lot more comfortable. We've spoken to women who have delivered without chiropractic care and then delivered with, and they tell us in most cases, they tell us there's no comparison. It is much more comfortable under chiropractic care. We have had midwives refer their clients to us because they felt that the pregnancy would go more smoothly if they're under chiropractic care at the time, and especially not just during the pregnancy, but after delivery. The ligaments that have become loosened to allow that delivery to happen are now going to retighten.
Right.
The last thing you want is for the pelvic skeleton to retighten into an abnormal position. Now you have a permanent subluxation. So in addition to during the pregnancy, for the 3 months or so after pregnancy, chiropractic care is a very, very wise idea. So that part of it was true. Restoring an incomplete cervix,
Not so much.
I have, as a chiropractor, I have trouble with that one.
Okay. Well, let's talk about, because you told me at one point in time that there was a lot of research going on in chiropractic care.
Absolutely.
So has that been long-standing? Is that something new? What's all of that? How do you do the research in chiropractic care? It's not like testing a drug.
Yeah. No, it's very different. Is it long-standing? Is it new? And the answer to that is yes. Okay.
Great, both.
Because research really began in the early days of the profession. The problem was from 1895 to 1975, that research was pretty much invisible to the scientific community. There were no biomedical journals that would publish our research. So this was something that was pretty much known within the profession. What changed in 1975 is there was a conference at NIH in Bethesda, Maryland, that involved doctors of chiropractic for the first time, medical doctors, PhD researchers, other health specialties, and it was a conference on the research status of spinal manipulative therapy. And there, in 1975, for the first time, we were in an international scientific venue in which our research was getting published. Shortly after that, in 1978, we produced the first biomedical journal or bioclinical journal by the chiropractic profession that is internationally indexed. Now our research is visible. Now the scientific community and the general public can access it. So it's almost as though our research has come out of the closet.
I was going to say that's a long time for nobody to sort of be paying attention to the research that was being done. I mean, was there just sort of a general, sort of along the lines of my mother's view of this, they don't really know how it works, so it can't really work?
Yeah, your mother's chiropractor, Dr. Butcher, was the recipient of a point of view that did not rise in the public mind by accident.
Okay.
That was very carefully planted. As a matter of fact, from 1906 to 1974, the chiropractic profession's major endeavor, besides research and besides serving our patients, was keeping our fellow chiropractors out of jail.
Really?
Chiropractors were routinely arrested and sent to jail on charges of practicing medicine without a license because there were no licensing laws for chiropractic in many states up until that time. The first chiropractor that went to jail was a person I mentioned before, D.D. Palmer, the founder of chiropractic, spent some jail time. The last chiropractor left his jail cell in Louisiana in 1974. I met him. I got an autograph by him, and he told a wonderful story when the deputy sheriff came to arrest him. That deputy sheriff was a patient of his, and he was very, very apologetic. I'm sorry, Doc, it was E.J. Nasser. I'm sorry, Dr. Nasser, but I have to do this as part of my job. Brought him to jail, locking him up and said, it's a little bit awkward to bring this up now.
Oh, no.
But I've really been meaning to come in. Dr. Nasser puts him on a bench in his jail cell. So I'm mentioning this because it's a great story, first of all, but second of all, this is a part of our professional heritage. Locking us up in a jail cell will not stop us from serving the public. I like to think that that's still a part of our professional orientation as well.
Wow, I had no idea that you could get locked up for being a chiropractor back in the day.
Only if you practiced.
Only if you practice. Wow, that's pretty amazing. That's pretty amazing. So now we get to 1975. You're in this big meeting over at the NIH, and all of a sudden the sun comes up and starts shining on chiropractic care, and everybody is joining hands and singing Kumbaya. I mean, what happened after that?
Sometimes there's a kumbaya, and some people are still stuck in the jail cell. It was a process.
Okay.
It was a very, very gradual process, and there were lawsuits involved, and there were changes involved, and there are licensing laws involved. But the situation today is very, very different than it was in the 1970s prior to the 1975 conference. There is a certain amount of biomedical and chiropractic cooperation these days. Some medical doctors are still looking at Dr. Butcher, like your mother was. That still exists. There are patients being told, I'm going to refer you to somebody else. Don't go to the chiropractor anymore. But that used to be universal. Now, medical doctors that say things like that are sort of viewed as being somewhat like a dinosaur.
Right.
It's much more common to find cooperation. We just recently attended a conference sponsored by Inova on minimal brain dysfunction and coma. Not coma, concussion. And that was attended by chiropractors, medical doctors. We're in the same seminar taking notes together and referring to each other. It's a very different atmosphere.
Well, we're going to be going to break in just a minute, but I want to sort of let you know when we come back, because your mention of concussion and brain stuff triggered in my mind. I was told that your practice actually does a good deal of work, a lot of it volunteer, with veterans who have been coming back from the wars. And I want to talk a little bit about that. I have a special interest in that.
I know you do.
With my own son. So we'll talk a little bit about the work you're doing there as well as that research when we come back from the break. So stay with us. We're going to be back in just 2 minutes.
There's more than just books at the library.
There's more than just books at the library.
Excuse me. There's more than just books at the library.
Il y a plus que de livres à la bibliothèque.
A lot of great books here today. There's more than just books at the library.
I know.
There's more than just books at the library.
I don't want to be hooked to a machine.
I want all the medical treatment available to me.
I wouldn't want my family to have to make this decision.
My doctor knows what's best for me.
An advance directive is your life on your terms. Talk with your family. Decide what's right for you. Then put it in writing.
Documenting my wishes today means my family won't have to make heart-wrenching decisions later.
To learn more, visit www.putitinwriting.org.
1,200 American youth run away from their homes every day. The National Runaway Switchboard is here to help. 1-800-RUNAWAY. If you are a runaway, thinking about running away from home, or a parent or guardian concerned about issues facing your child, call us 24 hours a day. 1-800-RUNAWAY. In times of crisis, hope is just a phone call away. 1-800.
We're back to the Inside Scoop. Here again, your host.
Welcome back to Inside Scoop Virginia. I'm Bettina Lawton, your host, and we are continuing our conversation with Dr. Chuck Masarsky, and he is a chiropractor. He practices here in Vienna, Virginia, actually with his wife, who is also a very talented chiropractor in her own right. And I wanted to talk with you. We mentioned this concussion seminar that you were at recently with all of these other doctors. So I want to ask you, first of all, what can, because concussion's a big deal. I mean, they talk about it both in the professional sporting arena and also now a lot of it in high school. And I know in some of the school-based groups, parents are like, how can you possibly let your child play football, blah, 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 because of the concussive things. So can chiropractic be useful in treating them? I mean, what's the connection with chiropractic care and concussion?
We don't have a lot of scientific literature yet on chiropractic and concussion per se. But what struck me at the seminar is when they were talking about the clinical signs of concussion, and it is mostly clinical signs because a concussed person can have an MRI and come up completely normal. There aren't any gross anatomical changes that happen with that. So they are signs and symptoms such as dizziness, confusion, visual distortions, memory problems, attention deficit, and things of that nature. Well, we don't have any literature on chiropractic and concussion, but we do have literature on chiropractic and attention deficit, chiropractic and visual problems, chiropractic and dizziness and equilibrium, chiropractic and reaction time, many, many components that deal with the response of brain function when you clear out nerve interference through the chiropractic adjustment. So it struck me as certainly among the other avenues you would pursue, getting a chiropractic evaluation would be very valuable, because if you have a concussed brain, the last thing you need is more nerve interference.
Well, that makes some sense. I had a concussion a number of years ago, and it was that feeling of everything would spin. Just all of a sudden it would just start to go, and they gave me these drugs. They told me to go see this, I don't even remember who the guy was, but go see this guy. And he gave me these drugs. And so I'm dutifully taking the drugs, and I wasn't feeling better. So I read the side effects. I guess I should have read them first, because this was for my dizziness, and the side effect of the drug was dizziness. And so I was like, I'm not sure this is helping me. And it never had really occurred to me that chiropractic could have helped.
Again, we don't know for sure. But the worst thing that'll happen is you'll get adjusted, and at the end you'll still be concussed.
Well, there is that.
Again, heads you win, tails you break even. But there is valid scientific evidence about these components: the dizziness, the memory problems, the attention deficit, the reaction time.
Okay. And is that the same answer on like the traumatic brain injury area, where you can treat certain research on certain of the symptoms, or is there research on chiropractic care and traumatic brain injury?
Not a lot yet on traumatic brain injury, although one of the things that was we're understanding concussion a lot more than we did 10 years ago for unfortunate reasons. We've had a lot more traumatic brain injury as a result of our activities overseas. But it's a lot of times there is traumatic brain injury when there has been no blow to the head.
Really?
One of the things that came up is, in actuality, many people who've been through a whiplash injury actually have traumatic brain injury, because that acceleration and deceleration of the neck and head cause injury to the brain as well. And that makes sense. Once it's said to you, it makes a lot of sense, because we're very familiar in our practice with whiplash patients who have dizziness, attention problems, memory problems, slowed reaction time, equilibrium problems, and so forth. So that makes a great deal of sense. And so, we've been dealing with those since the beginning of the profession. So we may have been unwittingly treating people with concussion and minimal brain injury for many, many years.
Okay. Now, tell me about the work that you do with the veterans. I heard about that a couple of weeks ago and thought, wow, I had no idea. So what is it that you do with the veterans?
Well, this had its beginning with the 9/11 terrorist attacks, actually, and it started as a very unplanned thing. In New York City at Ground Zero, as soon as that happened, or within hours of when it happened, when everybody was running away from the toxic cloud of dust and debris rising over the ruins of the World Trade Center, chiropractors in New York were closing their offices, taking portable adjusting tables, and getting as close as the public safety people would allow them to get, opening their tables in any building that would allow them, and treating rescue workers, injured people, people who were looking for free, and that went on for about 2 weeks. In the meantime, here at the Pentagon parking lot set up a tent with a series of tents, actually, with counselors, nurses, various types of therapists, and the International Chiropractors Association set up a station with chiropractic care. And that was running around the clock, day and night. I was there for a number of shifts. A lot of my colleagues were there for a number of shifts, and we're doing that. Well, what grew out of that was a program for returning war veterans. And it's not just our office. Myself and my wife and practice partner, Dr. Marian Todorus, are part of this, but many chiropractors across the country are participating in this program established by the International Chiropractors Association. And by the way, the research I'm talking about and this program, I will have links to that for those who want to get in touch. I think there is an email address being flashed on the screen occasionally. Get in touch with us if you want some of the references of some of the things that I'm talking about, and I will make sure that you get that, including this ICA program. Someone who has been to the war zone in Afghanistan or Iraq is entitled to 1 year of chiropractic care free of charge.
Wow.
And we do that, and we've had a number of people involved in that program. I'm pretty sure that you've been aware of some of that.
Yeah. I actually first became aware of you with my son, and I had not understood that was the connection.
It was an honor to see Josh for a year free of charge.
Yeah, it was, and I definitely appreciate it, because when he came back, it was not a pretty sight. Definitely not a pretty sight. So, well, good. Well, let's talk about some of the other research. Have you actually done any chiropractic research yourself?
Yes. Dr. Todorus, my wife and partner, and I have published a number of research papers. And as clinicians, there are limits to what we could do in the research arena. But what we can do is we can publish case studies and case series. And we've done a number of those. And we could discuss those more specifically as we go along.
Well, let me stop you for just a second.
Sure.
So I know what a case study is, but what's a case series?
What's
the difference between those two?
A case study or a case report is one patient who had some interesting features. So you describe that patient, how they presented, what their signs, symptoms were, what your approach was, and how they responded in as much detail as it'll take for somebody else to replicate the findings with a similar patient.
Okay.
A case series is the same thing, except it's more than one patient that have so 3 patients with minimal brain dysfunction, 4 patients with migraine headache, 5 patients with low back pain, and pain radiating down the leg. Similar cases, and a series of them, so that you can show some of the similarities and differences in their response to your type of care.
Okay. And you mentioned migraines, because I have a number of friends who have them, and they say they're completely debilitating, and there's all kinds of drugs they take that don't seem to work. So is chiropractic effective with migraine issues?
We've had a number of patients with migraine who respond very well. Some of them do respond very well. With some of them, they don't respond as well. There have been a number of papers published indicating a very good response with migraine. And here's the interesting thing. When you look at the clinical presentation of a migraine patient, and you go back to what we were just learning about people with concussion, there is a very, very close similarity. Dizziness, equilibrium problems, focus problems, attention problems, memory problems. in migraine. Photophobia, an aversion to bright light, an aversion to loud sounds, phonophobia. Very common with migraine, very common with post-concussion patients. Okay? We're starting to think that there's a whole constellation of problems that are basically the brain shutting parts of itself down, a metabolic problem with the brain, something that will not show up on an MRI because there's nothing anatomically wrong with the brain. It's not brain damage, it's not a stroke, it's the brain just not working up to its full potential.
Wow. And you can't really, I mean, you can't like do an MRI, you can't, I mean, are PET scans, can they find those things?
Yeah, there are more advanced forms of imaging that give you brain function, and they're going to that more with both concussion and migraine.
Okay.
Yeah.
Okay. So that could be something. Does it work for, just wondered about this, does it work with allergies? I know a lot of people do acupuncture for allergies. Does chiropractic work for allergies?
Yeah, saying acupuncture for allergies is a little bit misaligned from the mark. And saying acupuncture for allergies, chiropractic for allergies, a little bit off the mark. It's not that there is an acupuncture point that makes allergies go away. It's not there's a place we adjust you that makes your allergies vanish. Right? We're coming from a very similar place with acupuncture, and I'm glad you brought that up. Just as we are trying to make information flow in a more accurate way through the nervous system or assist the body in doing so, the acupuncturist is trying to make various forms of energy flow more readily through the body, which traditionally they call qi or ki, right? So we are going to normalize the nervous system. We're going to assist the body in normalizing the nervous system. And very often, the distress of allergies, the sneezing, the coughing, the difficulty in breathing, the red eyes, improves as the nervous system functions more accurately. The acupuncturist is going to analyze the energies and help those energies flow more freely, and very often the allergic symptoms will abate. So the quick answer to your question is yes, we've had allergy patients. I'm one of them. I do much better when I'm under chiropractic care. My wife and partner is also my personal chiropractor. So
how convenient for you.
How convenient for me, you know, with she's very bright and has great experience, and you know, the effects have been very good. Is it a total solution? No. You have genetics that give you allergies, and we don't change your genes. But we change the expression.
Okay. All right. Well, good. When we come back, we're going to talk some more about some other things that chiropractic care can help with, some of the things it can't. And then I also do want to go back to your time at Nova as your instructor, because I thought that was interesting when we were talking about it. So stay with us. We'll be back.
Osama bin Laden calls getting nuclear weapons a religious duty.
Today, materials that can be used to make nuclear weapons are stored in more than 40 countries.
Sometimes protected by just a chain-link fence.
Yet not enough is being done to lock down these materials
before terrorists steal them.
Why did we learn all this?
My mother.
My son.
My sister-in-law.
Were all murdered September 11th.
Help protect America.
Together we can.
Please join us.
The stem cell issue is being debated throughout the country. Truth is, most everyone has an opinion, even if they don't know the facts.
Let's stop arguing and start really understanding the potential of stem cell research.
For us and for millions of Americans living with disabilities, get the facts.
Call 1-877-842-3442 for free information from the Stem Cell Research Foundation. That's 1-877-842-3442.
Following the tragic events of September 11th, there have been hundreds of violent attacks against innocent Americans.
Remember what that flag you're waving stands for.
Remember, please stop the hate.
We're stronger when we are united.
Remember
what that flag you're waving stands for.
One nation under God.
Indivisible.
With liberty
and justice
for all.
In America, there's either room for everyone or it's not America.
Don't pick the wrong fight.
Let's keep America land of the free.
Stop the hate.
Planning a home renovation? Put this at the top of your to-do list. Because after 10 years, none of you are protected against tetanus and another potentially fatal disease, diphtheria. A minor injury, such as a cut or a scrape, can put you at risk for a tetanus infection. And while safety gear offers some protection, an up-to-date vaccination called the TD booster is the best insurance against tetanus. So get the TD booster. If it's been 10, do it again.
We're back to the Inside Scoop. Here again, your host.
Welcome back to Inside Scoop Virginia. I'm Bettina Lawton, your host, and this is our final segment with Dr. Chuck Masarsky. He is a chiropractor here in Vienna, Virginia, and we're talking about chiropractic care, what it's good for, what it's not good for. I've heard how it started, talking about some things that are kind of myths. And we've got a couple other things that I want to talk to you about, because I know at one point that you made a comment or were looking for people to study creativity, chiropractic effect on people's creativities. Whatever happened to that? I remember hearing about it a while ago. Were you able to do anything in that?
Yeah, we've published 2 papers in that area. And we wanted people to first of all understand that creativity is not just about writing a novel, not just about making a sculpture, and not just about painting the Sistine Chapel. Obviously, those are very high forms of creativity, but it's an ordinary function of the human brain. Somebody who has just had their income reduced and has to figure out how to feed their family nutritious meals on a low budget, how to alter their shopping, their cooking, their preparation, that involves creativity. Somebody who's faced with a business crisis, they need to get out a new product, a new service, a new way of providing that product or service, a new way of making the public aware of that, a new way of functioning with a reduced space, reduced capital, an uncertain environment.
All of which we have here in Northern Virginia.
And the rest of the country. That involves creativity too. Innovation is creativity. So, we took that approach. And this project that we published the 2 papers on was very, very simple in its design. There are some simple tests of creativity. We did them before and after a chiropractic adjustment. And then we waited a few days and interviewed. And we asked people, on a creativity project you're working, have you noticed any difference? Are you less stuck? Are you less blocked than you were before? One of the subjects was a 10-year-old boy who was working on a school project, an art project, in which he was drawing imaginary creatures, cartoon style. And he started, in the interview, he told me that he started to draw them with 2 faces, so he could show 2 different emotions in them simultaneously. And his parting comment in that interview was, "I've never drawn that way before." Another participant was a professor at one of the local universities, and the question that we ask on the creativity test is, take a common object and in the next 10 minutes write as many uses as how many uses can you think of for a shoe, for a brick, for a comb, for a newspaper, right? And the more odd the uses are, the better.
Okay.
And he's doing the post-adjustment assignment, and he's writing the number of uses for a newspaper. Afterwards, he told me, this wasn't part of the interview, but he volunteered this information, that after 2 or 3 minutes, he realized that he was looking at the task in a very limited way. He was thinking about the articles in a newspaper. And then his words, a sort of rush came over him, and he realized he should also be thinking about the physical newspaper. Can it be a hat? Can it be a doorstop? Can it be a placemat?
Interesting.
And so forth. So, we had a lot of responses like that. 20-something subjects, 27 subjects. Statistically, the overall results, for those of you who are familiar with this terminology, were statistically significant. So we have the beginnings. We would like some more subjects. We would particularly like some people in the business community who are having some blockage on an innovation challenge in their place of work, but we are also looking at the traditional novelists and artists and so forth. Anybody who's stuck in a particular creative task, we would like to get in touch with you. I believe our Vienna Chiro at Comcast.net has been appearing on the screen. You can get in touch with us that way. We are also at 703-938-6441. And
you have a website, Neurological Fitness, right?
Neurologicalfitness.com has a lot of this information as well.
Okay. And we've got the Comcast.net email. So as you've mentioned various studies that have been done, anybody who is interested in those studies and wants to get a hold of them, just feel free to email Dr. Masarsky at Vienna Chiro at Comcast.net.
Yeah.
And he can get those to you.
No researcher is afraid of somebody reading their paper. They're afraid that nobody will read their paper, so this is fine. You know, as many people that want to read this research, we're happy.
Okay, good. Well, let me ask you about some other things. I think we've talked a little bit about breathing in the context of things like whatever. I can't even remember. See what's happened to my creativity is gone. I clearly need an adjustment right now.
Your name was?
Exactly.
This is Fairfax Public Access.
That's what we're doing here. But what about breathing? Because I know that you have done some looking at making those adjustments. That doesn't seem like a nerve thing to me. That seems like just mechanical stuff.
Well, it's both. It's both. It's nerve and mechanical. To get a normal deep breath, obviously many mechanical things have to happen involving the breathing muscles, involving the rib cage, involving the attachments of the rib cage to the spine. So that's true. All of the muscles that control those mechanical events, though, are controlled by nerves. The smooth muscles in the bronchi of the lungs are controlled by nerves. The smooth muscles in the blood vessels that go to the lungs and pick up the oxygen, those muscles are controlled by nerves too. So there's a lot of neurological involvement with that. Our research was very simple at first. We took a number of new patients, 50 some odd new patients. Mm-hmm. How much air could they move in one deep breath? Mm-hmm. It's called vital capacity. It's measured with an instrument called a spirometer. How much could they do that at the beginning of care, and how much would their lung volumes be after several adjustments? And there was a very, very significant improvement as a group. Interestingly enough, there were some people that had normal lung volume at the beginning. Mm-hmm. You could calculate normal based on a patient's height and age. Right? Mm-hmm. So they had normal lung volumes, we adjusted them, and they got better.
Wow, so that would be good for like athletes to do that.
Excellent. That's almost like someone coming in with 20/20 vision and leaving with 20/15 vision, which sometimes you also see under chiropractic care. So it started that way. Then one day somebody with chronic obstructive pulmonary disease came to our attention. Some of you know this is COPD.
Right, the elephant sitting on your chest in a commercial, right?
Emphysema and or chronic bronchitis. He had had this for years. He had lost a part of his lung. He was unable to exercise because it was too difficult. We decided to give him more than a year of free chiropractic care if he would come in faithfully 3 times a week so we could study him. We made measurements with the spirometer. He kept diary notes, and he came in 3 times a week for 14 plus months. Wow. The improvement in lung volume was more than a liter. Okay? And some other changes happened as well. You mentioned allergies before.
That was the word I was
Every
missing.
year during the hay fever season, during the tree season, he would get allergies so severe that he lost his sense of smell. Turns out, because we went 14 months, we went through 2 tree seasons during the study. According to the pollen data, which we collected from the Lung Association, the second season was worse than the first season. He was not worse. He was better that second season. So lung volumes went up, allergies went down. A couple of very interesting things happened. He was awakened by his wife in the middle of the night. She was terrified. She was shining a flashlight in his eyes to see if he would wake up. For years, she had been listening to his labored breathing, which she described as sounding like a freight train. And one night, she was in the presence of silence.
Oh, dear.
And she thought he died. She thought he died. She woke him up. So we saw changes like that, and it was a very gratifying study. There have been studies on chiropractic and lung volumes before our study. And I'm very gratified to say a number of studies after we did our research, so some other people have picked this up, and the evidence is mounting very nicely that the chiropractic adjustment is good for breathing, and that lung volume, that is also a measure of longevity.
Oh,
the
really?
better you're breathing, the more likely you are to live. That's not from our research, that's from something called the Framingham study, which has been going on since the 1940s.
Wow, that's amazing. Because there's a lot of people around this area with the allergies. I know a lot of people that have suddenly gotten asthma type stuff. And
yeah, you should
so
breathe. You should breathe every day.
It's
even
kind
if
of
you're not in the
essential.
mood.
Exactly. Just do it.
Just
right?
do it.
Just do
breathe.
it.
Just breathe.
Just breathe. It's okay. Okay. It's friends of mine who wake up and say, "It's a great day. I woke up. I'm breathing. I'm
Absolutely.
good." Let's talk a little bit in the last minute or two that we have about what you do at Nova, because you teach anatomy and physiology over there,
right.
and which I would never. I just my younger son took that, and I could never figure that out. But you talk about doing it in a different way. I always think of it as you go in, you open the book, you study the picture, and you don't do that. Talk about how you do this over at Nova.
I do a certain amount of open the book and look at the picture, but I'm interacting with people live. We're doing it in a live way. So I try to introduce some clinical exam steps. For instance, in one of the courses I teach, it's a lab course. So we do some of the traditional lab work. We break out the microscopes and we look at slides and we do all that sort of thing. But I also break out the reflex hammers and have them do reflexes and muscle testing and sensory testing and pupil testing and looking in this direction, that direction, and then get them to understand what that has to do with the functioning of the nervous system, what that has to do with the functioning of the other systems in the body, and try to get them to think about the human body in a way, to use a hackneyed phrase, that's more holistic, that gives them a more general sense of how everything works. One thing that I've started to do with my classes, and this isn't especially a chiropractic thing or anything like that, but I realize I'm sitting in a class that normally is 40, 50, 60% composed of people born outside of this country. They're from somewhere in Asia, somewhere in Africa, somewhere in the Middle East, somewhere in Latin America. And a lot of them have cultural methods of healing that they've been exposed to during a lifetime. So sometimes I take out a little bit of lab time, a little bit of extra time. What have you experienced from your mother, your aunt, your grandmother? And we discuss that and we see if there's been research in those methods.
Oh, how cool.
And it deepens things for them.
Sort of a whole cultural sensitivity kind of thing going on.
Yes.
Well, I want to thank you for coming. This has been very interesting. I feel like I know a whole lot more about chiropractic care than I did when I started. So I want to thank you, Dr. Chuck Masarsky.
Thank you so much.
Vienna Chiropractic. Go see him.